The new weight loss medications are the buzz on social media right now. As a pharmacist, I know that medications can be safe and effective, but they also come with side effects.
Yay Networks.
A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter and they really help us. Y'all are about to hear a really interesting episode with Dr. Alicia Reed. We're talking about weight loss medications, prescription weight loss medications. She and I recorded this episode just a couple of weeks ago. And in the interim, just between when we recorded it and when it's airing this week, there's been so much more about these weight loss medications that has been in the media. And so I'm kind of doing a little addendum here at the beginning on, there's a really cool article in the New York Times last week by Danny Bloom that I want to just share a little bit with y'all about it. She talked with physicians to say basically what happens when someone stops taking these medications. And specifically, the medication that she was covering for this article I'm talking about, and I'll link to it in the New York Times. She was talking about Ozempic, and you'll hear Dr. Alicia Reed, our pharmacist, talking about, several different weight loss medications, but Ozempic is really probably the one that is, I don't want to say the most popular, but the most talked about. You may have heard people use the phrase Ozempic face, and Ozempic face is, that person who's lost so much weight that the facial fat is also gone. And so they may look leaner, but then their face also has what's described as kind of that sagging or gaunt look in their face. Because that weight loss has usually been fairly rapid, it's also very noticeable. And so there's that term Ozempic face was created by a dermatologist who had, kept seeing these different patients who were coming in and seeing the sagging and complaining about it and wanting filler and these other kind of solutions. And so you may have heard Ozempic face. As you look, that's also just a side effect to know of that maybe people aren't talking about, or if you're looking at the website for Ozempic, you'll see a bunch of different side effects. Dr. Alicia Reed talks about these. So also know that these are not side effects to take lightly. There's something to really consider all sides of it, and 100% talk with your healthcare provider about the pros and cons. And you'll also hear Dr. Reed, she's had those own conversations with her own physician. So I won't go through all the side effects because she and I talk about it, but Ozempic face is one that we really hadn't so specifically referred to it as that. That getting into this conversation about, well, what happens if you stop taking it? And a lot of times we see this with trendy diets. So something like the Ideal Protein or something, we see people who, wow, they had such great success as they were, eating these prepackaged foods and following this very strict regimen. But when they go off of it and they go back to, even somewhat of a normal approach nutritionally, they're seeing the weight come back on. And so this is something that is one of the biggest things that when someone does stop taking Ozempic for whatever the reasons may be, one of the things that they're seeing is that the weight comes back on. And for many people, it's coming back on quickly. They're feeling just insatiable. They're hungry all the time. So when someone is taking one of these weight loss medications, and again, we'll talk about Ozempic specifically here, one of the biggest things that they're noticing is that they don't really have an appetite. They don't have the cravings they had. They don't have the level of hunger. They can eat much smaller amounts and they feel full. They feel satisfied. And so that is also why they're, largely why they're able to see that shift in weight, that weight loss, that fat loss. And that's why it can also be so rapid that it's showing up so quickly in their face to warrant the Ozempic face that we talked about. So when someone stops taking it, it's no surprise that that curbing of the appetite, would not be so effective. But what's happening is people are really surprised with just how quickly it's happening. So as soon as they're coming off the medication, almost immediately they're ravenous, they're having these cravings, everything sort of rebounds and in some cases feeling even stronger than it did before in terms of cravings, appetite, that insatiable hunger. And so what people are seeing is, okay, especially if someone had diabetes or they were taking Ozempic to help manage their glucose levels, they may come off of it. They find that they're starting to gain the weight back. They may try other medications to help manage those glucose levels, but a lot of times they're ending up on Ozempic a second time. The problem is maybe the reason they came off of it in the first place was if they were nauseous or having some of these other side effects. So coming off the medication can always have that rebound weight gain, that rebound appetite and cravings. So we see the cravings, appetite, and weight gain. Also, I mentioned a glucose rising. And so this is something that, again, no surprise, if you stop taking it, it's not going to have this, you're not going to be experiencing the same benefits that you had of lower glucose levels, lower appetite. So again, if someone is taking it for weight loss, then when they stop, of course, their glucose levels can rise. The same side effects, especially someone with diabetes, can have the same side effects that they maybe originally had before their glucose levels were in control. So some of the things that are mentioned in this article is that patients with diabetes, if and when they stop taking the Ozempic, their glucose levels rise. They can experience things like blurry vision, fatigue, excessive thirst, urination, those same symptoms that led them to the doctor originally to get the diabetes diagnosis. They're right back where they started as soon as they're coming off of the medication, and many times. And then again, those cravings coming back, rebounding so quickly. And so if physicians comment that they've seen people, they've maybe lost 50 pounds, they've kept it off. And then when they do try to come off the medication, 20 pounds comes right back on. So just being mindful of this, that just like anything, as you're listening to us talk about these weight loss medications, they're not a magic bullet. Nothing is without side effect. Nothing is without consequence. So it's really important to know that even if you're listening to what you're about to hear with Dr. Alicia Reed and I, and you go, you know what? I'm hearing all those side effects you're talking about. I hear it. I'm willing to roll the dice. I'm willing to take that gamble and I want to try it. Just know that, again, if this is what's leading to that success and other habits and other shifts are not also being implemented at the same time, then we are really taking that first big step onto a giant roller coaster. So with that, we'll get into our original episode as planned. Weight loss medications, weight loss drugs. It's a topic that there's a lot of conversation around it. There's a lot of questions. There's confusion. It can be a divisive topic, a polarizing topic. And it's one that I know a little bit about. And it's something that I get questions about a lot and would love to learn more about this topic. And so it's something that, as usual, I'm bringing y'all along with me as I'm learning more. And with us, we have a guest who's joined me before, local pharmacist based here in New Orleans, Dr. Alicia Reed. Alicia is someone who I love her energy. I love her outlook. I love her candor on topics. And so having her here to share her knowledge as a pharmacist on this topic, she's also an incredible self-care advocate and expert. She's host and author of the blog, yourselfcareprescription.com. This is something that she lives with just every fiber of her being. The idea, the concept of self-care, it's something that she continues to learn about. She has her struggles, she has her challenges that she shares openly about, and also the forward movement that she experiences that can help us as well. So with that, welcome, Alicia.
Hi. I love that introduction.
It's so true. I I love your energy, your knowledge, your brain space. And this is something that you posted on your social account a couple of months back. And I was like, wait, I messaged you immediately. And I was like, this is a topic, weight loss drugs, weight loss medications, that I had been thinking, gosh, we need to do a podcast on this. And when I saw you post about it, I was like, got to have you on.
Yeah, I mean, it's a question that I get often, and I just want people to have the information, and because I feel when you have the information, you can make an informed decision.
Talk to us a little bit about your background as a pharmacist, because you're a pharmacist, so you know the medication, the pharmaceutical world, and you also overlay that with a very strong lifestyle approach. So talk to us about that too.
So I have been a pharmacist for 20 years. I've worked in many different areas of pharmacy, retail pharmacy, like your big boxes, CVS, Walgreens. I've worked for managed care, a healthcare plan where I, reviewed requests and formularies of medications. And then lastly, I'm working in a hospital system. So I've had experience in all of those areas. And what I found was obviously the connection between medications and health conditions, realizing that you can't just take the medication for the health condition or the chronic condition. You still have to do other things. And those other things are lifestyle modification. And that's where I wanted to focus on self care because, you know, you still have to practice self care while you're taking your high blood pressure medication. Or, you practice self care to prevent high blood pressure or diabetes. So I just thought it was a perfect opportunity to merge my love of pharmacy and self care.
And so many times too, the things that we may do of, you know, things that might be stress reducers or watching our diet, our sodium intake or processed or refined foods, getting moving more often. These are things that can help things like blood pressure. They could help glucose levels. They can help our weight, our stress levels, our anxiety levels. Like there's so much that you're seeing people get medicated for. Yet, what are we doing that are these lifestyle edits, And I think it's medications that people may be, providers may be quick to prescribe, patients are quick to ask for or simply take these. But it's not just medications, it's also supplements. We see this a lot. People want to,
Yeah.
what's that quick remedy, quick fix that I can have when there's that whole world of our lifestyle that unless we get kind of that core foundation steady, then it is just kind of like it's a little bit of a band-aid, you know, if we're not getting that core. So that lifestyle approach that you have is tremendous in communicating this message to patients and not just to patients, but to people who are, using your website as a resource, looking to your social media. Your social media has funny things. It has heartwarming posts. You include your son. There's things that are like, oh, that's hilarious or that's cute or that's funny. And you also have a lot of education there. So share, we've got your website and we'll say these again at the end, but just in case we forget to say it, your website is yourselfcareprescription.com. And then where can someone follow you on social?
Dr. Alicia Reed,
So you'll
but on
see,
Instagram.
okay. And y'all see what I mean. Lots of educational and funny and inspiring and all of that there. So on the topic of weight loss medications, weight loss drugs, there's so much here because you have your knowledge as a pharmacist. You also have personal experience with this. Where do we want to start?
When we have all these commercials, I guess just starting with, and there are drugs to treat obesity. Like really discussing that it is a chronic disease. Like, you know, people don't realize that that is a disease. It is a condition, and that there are medications available that are FDA approved to treat it.
You pointed out, in our kind of pre-podcast conversation that the American Medical Association, actually officially recognized obesity as a chronic disease almost 10 years ago. And so we think about chronic disease as, heart disease as a chronic disease, but obesity has been recognized as this. And, there's probably, it's a roughly three quarters or, almost 75% of adults in the United States are either, overweight or obese. And so when we say three quarters of people, almost 75% of people, there's a lot there. And then when you look at the other risk factors that can lead to, all those things we talked about before, heart disease, diabetes, blood pressure, energy levels, esteem issues, sleep issues. I mean, it just spirals from there. So really getting at the root and treating overweight, obesity, and there's going to be so many different ways. So for some people, they may try nutrition. They may meet with that dietitian. They're working, they're getting moving. They're looking at, okay, they feel as if they've tried the traditional diet and exercise. And when, I guess, when would it be that a physician or a provider would say, we may want to consider medication? And we're going to talk, y'all, we're going to talk about what are some of the current medications, what are some of the past medications that maybe you heard about, and some of the side effects of those. What's the new generation of medications like? What are still some of the risks of these? And, but starting out first with, what would be the kind of catalyst for someone to have this prescribed to them?
Well, what I'm seeing is, the patients that have diabetes. So, if they have diabetes and they are obese, this would be, obviously an appropriate prescription. There are also individuals who may not have diabetes, but they are on other medications or they have other conditions that can lead to weight gain. If you have an underactive thyroid, if you have PCOS, which is polycystic ovaries, those conditions actually contribute to obesity. And then there are medications. A lot of people are on antidepressants. And I mean, especially, going through COVID and the pandemic, people have been prescribed antidepressants, which cause weight gain. So, someone could have easily put on 40 pounds over the 3 years, and it would be appropriate to prescribe. And I also think, if someone's on steroids, like the actual like corticosteroids for other conditions, that would be appropriate as well.
Do you think that, or I guess, like, are you ever in a position that, or do you have a sense that providers are first trying to encourage patients to make these lifestyle changes, or do you think that there's like a either a quick to prescribe, and then also patients who are quick to ask for these medications?
So I think it is, I would say that the patients are probably more quick to ask than prescribers are quick to
Yeah.
prescribe because, good provider, a good physician is looking at all of your medical history and all of your, they can see a trend and weight. They can see what medications you're on. So I feel confident in the fact that doctors are really prescribing the medications appropriately if they see someone who, has had an increase in weight gain over a period of time and they have other health conditions.
Or they know that they have tried XYZ and
Oh
still
yeah.
struggling. Like, the the medications are not without side effect, though. I mean,
Right.
so I guess, where do we want to start on? There's, first of all, there are these medications out there, and there's like a new generation of these
Yeah.
medications. What are some of the names that people would hear? We'll start there, and then we can kind of back up a little bit.
So, if we can start with, I guess, the new kids on the block,
Yeah.
because of social media, obviously TikTok, celebrities, they are talking about these weight loss injections. They're calling them like weight loss injections, and though that particular class of drugs is also used for diabetes. So the names of Ozempic and Wegovy and Saxenda are out there, and that's what people are asking for. And there are other medications that aren't as popular, but it's Qsymia, which are Contrave, which are oral medications. But right now, what's hot are the weight loss injections.
And those are the injectables, as the Ozempic, the Wegovy, and Saxenda. Those are not
Mm-hmm.
the easiest names to say, and that's not just,
No.
like, as you look at like medications, there's kind of the generic, or like there's like the pharmaceutical name of it, and then there's the brand name, kind of the store name that you see on the packaging. And usually something like Saxenda may be actually the generic and it has an easier name. It's interesting because, like, I'm like, where did those even come from? Because they don't roll off the tongue, but they are rolling off the tongue because people are seeing them and they're asking
Yeah.
for it. And so those are injectables. How is it where someone injects themselves? Do they go to a facility? Does the pharmacist or their provider do the injection?
So patients inject themselves. So remember that these medications were initially approved for diabetes. So it was just,
Similar to how
patients were
they do
already
insulin.
self insulin. Yeah. So patients were already injecting themselves, as for insulin. And it was discovered that the medication also causes weight loss. So that's how it ended up being prescribed for weight loss. So this is something that a medication that was used in the management, and it still is used in the management of diabetes.
And some of them, like there's one that is it Ozempic and Wegovy? Are they both? They're produced by the same pharmaceutical company, but one.
So it, yeah, yeah.
Um,
So Ozempic and Wegovy, yes. So they are produced by the same company, and they actually have different indications. So like one is indicated for diabetes, and the other is indicated for weight loss, and that is really the only ones that are really prescribed, like labeled for that.
okay, and physicians are prescribing these often. Some are prescribed specifically for diabetes, but may be prescribed off label for weight loss.
Hmm.
And
Hmm.
so, who are the types of providers that would typically be? Would this be someone's primary care physician? Would it be who are the types of physicians typically prescribing it? And is it limited to just physicians prescribing these?
So typically, an endocrinologist, or someone who's managing your diabetes
Hmm.
or metabolic conditions would be prescribing. That would be
Okay.
like the top prescribers. But your primary care physician or specialist, like if you had a cardiologist,
Okay.
because I am seeing cardiologists prescribe for patients. My experience was, I seeing my cardiologist, and that was a recommendation.
The cardiologist
Um,
recommended for you.
yes. So
Which
I
one?
obviously, so he recommended the Ozempic. And we can, get into the side effects. I didn't want the Ozempic.
Yeah.
Um, I wanted another medication, which is Monjaro, which is, I mean, they're similar, but it's not FDA approved yet for weight loss, but it's actually, I think, been fast tracked by the FDA for the weight loss indication.
Let me ask, what did the conversation look like that the cardiologist had this recommendation, if you don't mind sharing?
Oh, sure. So we talked about it. We, we've had like several appointments. I see my cardiologist on a regular basis, and we were just looking at, like the weight gain, and we were talking about, the risk. Obviously, I'm 43, have family history, and we were just discussing like the risk and the conversation. We ended up discussing. I said, well, there's all these weight loss medications. Like, when would you prescribe them? And it was just okay. Well, then I feel like this will be an appropriate, because you've tried things and you are on other medications that contribute to weight gain, and like antidepressants um contribute to weight gain. So it was through conversation that we were kind of like, okay, this would be appropriate in addition to exercise
Right.
and nutrition. So it's not like it's a quick fix. It's just like, hey, this is, I can prescribe this for you, but it's in addition to diet and exercise.
I'll pause for a second and share. I mentioned briefly in the beginning that Alicia has been on this podcast before. We did a podcast specifically called The Raw Truth, My Raw Truth with Alicia. And Alicia's husband passed away. Is it 4 years, just over 4 years ago?
It's 3 years ago.
3 years
Three.
ago, right at Christmas time, of a heart attack. And something that stuck with me that you shared on that podcast is that your son, who is he 7 now?
Yes.
Yeah. He has expressed to you that he's worried about you. And just
Yeah.
as a child who's lost a parent, it's a natural fear for him to fear for his for you, for his mom. And so, when Alicia says that she meets with her cardiologist on a regular basis, there's a lot there of the why. Because you may say, well,
Yeah.
if she's otherwise pretty healthy, like why? But there's a lot there of the why. And so that's sort of it's also one of those where we've also talked on this podcast before. There's so many people who we have these sudden events, and we can't encourage you enough to not only be proactive and taking care of your health with what we're putting into our bodies and how we're moving our bodies and how do we manage stress and all of the things that Alicia is guiding and the self-care guidance that she's providing. We can't emphasize that enough on the self-care aspect, but then also being proactive with your providers, talking
Yeah.
with a primary care physician, meeting with that specialist, not being afraid to meet with a cardiologist, to have someone that you can go to regularly for that. So just kind of a sidebar of why is Alicia meeting with the cardiologist and having the conversation on the
Yeah.
regular. Okay, so the cardiologist had recommended one and you said you would prefer the other. Talk to us about the side effects, because when we pull up the side effects of any of these, I mean, you just scroll and scroll and scroll. They're lengthy. It's way beyond just nausea and
Yeah.
constipation.
Well, and what I like to tell patients whenever we talk about side effects, the companies are required to report every single side effect. So you're going to get the long list of side effects. But what really stood out with this class of medications was the like stomach upset and like the diarrhea and like nausea and vomiting. And talking to patients who are on these medications and who are on them for diabetes already and not for weight loss, they talk about the GI discomfort and how they're feeling. And for that reason, I didn't want that particular drug just because I knew
And
I
which was
had
the
heard
one that you're
that was so that's the Ozempic and the Wegovy,
okay?
like that one. I hadn't had a lot of experience with the Saxenda,
Hmm.
but the Monjaro, I had talked to a couple of people who were on it, and I mean they're all in the same class, so it's kind of like it's expected to have similar side effects, but it may be a little less than what the other ones were.
I'll pull up the Ozempic and the Wegovy. Like we said, they're
Hmm.
similar or similar if not the same, but one's prescribed for diabetes. They're different dosages. One prescribed for diabetes, one prescribed for weight loss. But the Ozempic or the Wegovy that she's mentioning, and again, the side effects can be really long. But when you look at a website that kind of there's some that'll class, okay, here's what's more common. There is bloating and constipation and the GI issues, but also, Alicia, things like anxiety, depression, dizziness, rapid heart rate. Those are things that, can leave us feeling like
Hmm.
really rapid heart rate and anxiety kind of go hand in hand, but also things like blurred vision or sweats or hives. So it's there's uh, even nightmares, and these were kind of in the more
Yeah.
common of that tightness in the chest. A few that also were showing up in the more common was skin conditions that might be like a skin rash or even slurred speech. And I think, oh my gosh, so those are things like not to take lightly. There's less common that can be like, and the less common were actually things that were like a lot less
Yeah.
dramatic. But those are not things that are like something to dismiss or just say, hey, I've got a few pounds to lose. Let me take this medication.
All
Like,
right. All right. Right.
what is your risk benefit here?
Yeah.
Okay.
And I mean, and if you look at the Monjaros, you can see that there's only stomach pain is their most common, and then they have the less common. So if you do like a side by side
Yeah.
effect profile, you can see that the Ozempic has a lot more.
Yeah.
But to your point, the side effect profile, just really trying to weigh the risk versus the benefit. Like,
Right.
do if you're trying to lose 10, 15 pounds, are you willing to have
Right.
this discomfort? Just
Right.
and it all boils down to you probably won't. And then,
Right.
and that, and that's how. But I also, what also concerns me about these medications is the fact that I am not a diabetic and I'm going to take something that could essentially lower my blood sugar.
Right.
So I am, worried about the hypoglycemia.
Right. Right.
And that is where you get the fast heart rate and the anxiety because, your blood sugar is dropping. And that feeling, I mean, that's not a good feeling.
Yeah. Yeah.
So, that's something that I worry about. What if I'm exercising, trying to
Right.
go along with,
Right. Right.
with the medication, and
Right.
then I have like a low, like my blood sugar drops and I need a Coke or something. So like it's just a lot that people don't think about.
And I pulled up the Manjaro that you were talking about. And, as Alicia said, the main side effect there, I mentioned that, some of the websites, because some of the side effects are pages and pages, and they'll like rank it as more common or less common. In the case of the Manjaro that she talks about, stomach pain is the only one listed as common. Less common, that's also a lot shorter list. And it's things that you typically do see, with medication. So I can see that if you were coming, and it's interesting because you're looking at it through the pharmacist lens, you're looking at it through that self-care expert lens, and you're looking at it through simply the patient going, "Hey, I could use a little help here." You've kind of got like those three spaces and you're all of them, you know? Let's talk about Green Chef, one of our sponsors for this week's episode. Green Chef is a certified organic meal kit company. They make nutritious meals incredibly easy with plans to fit every lifestyle, offering a range of recipes to suit nutritional needs and preferences. Green Chef features organic produce, premium proteins, and sustainably sourced ingredients. And Green Chef is more customizable than ever. In addition to swapping out the protein for organic beef or chicken or wild caught sockeye salmon, you can also add chicken or fish to specific vegan and veggie recipes that offer that added boost of protein. For us, Green Chef is a tremendous time saver. They also make it effortless to add variety and creativity to our weeknight meals. Go to greenchef.com/fueled60. Use promo code fueled60 to get 60% off plus free shipping. That's greenchef.com/fueled60. Use promo code fueled60 for 60% off plus free shipping. Green Chef, the #1 meal kit for eating well. Looking at, okay, having this conversation with your cardiologist, looking at here's what risk factors are, here's certain medications or certain things that are sort of, the odds are against you in terms of weight loss, making it more challenging for you. So
Mm.
the physician saying, okay, we can explore these. Um, how do and ultimately, I believe, like, it turned out your insurance isn't covering that.
Yeah.
Um, how do these medications, like, what's the mechanism of action? How do these effectively result in weight loss? Because the reports on these is that, people can lose, 15% of their body weight,
Yeah.
like significant. So how are they working for that to happen?
So it all boils down to the class of drugs. They mimic a hormone that really controls like your insulin levels. So what happens is like when your blood sugar starts to rise, it's a hormone that causes that's released that causes the body to produce more insulin to decrease the blood sugar levels. So that is basically how it works. So it's mimicking that, and that is causing blood sugar control and which results in weight loss. So it's just like it's it's pretty much working hand in hand with diabetes. Like, and I think what happened was it was just discovered as okay, the side effect ended up being
Right.
weight loss because you realize when your insulin levels are controlled, you feel you're full, you're not hungry. So it's like that is how it's working because it's, balancing your insulin levels so that you're not starving, you're not hungry, you don't have that appetite, your appetite, you're feeling full, and then you eat less and you lose weight. So that is basically how it works.
And influencing these gut hormones, specifically gut hormone that helps to tell the brain that we are feeling more full. And so
Hmm.
there's so many different types of hormones in our gut, some that are related to specifically hunger cues. And so there are hormones in our gut that can tell our brains that we haven't had enough food and that we want to keep eating. There's one, I always love the name of it is ghrelin because it reminds me of gremlin, like the
Uh-huh.
little hormone that tells us like keep eating. And then there's other hormones like leptin that are basically a fullness cue or fullness trigger that tell our bodies we've had enough. And so these medications are basically imitating specific gut hormones that are communicating to our brain that we've had enough, that we're feeling full, we're feeling satisfied, and that's how it's helping us to reduce appetite. So these are working in that way versus the old line of weight loss medications that were more well, tell us the difference between these and kind of the old school like fen-phen and phentermine and such.
Yeah. So the other drugs that we were familiar with years ago were called like anor anorectics. So
Yeah.
like they were drugs that were specifically their mechanism of action was just to reduce the appetite, and it was like a more like a stimulant because when you have a stimulant like you it's more like your adrenaline's rushing, so you're not hungry. Like
So
it's putting you into that fight or flight, yeah, fight or flight.
acting more on our central nervous system, raising blood pressure,
Hmm.
raising heart rate, having that stimulant effect, almost as if you had um like like if you would imagine like a high caffeine load.
Yes.
Yeah. So
Yes.
not caffeine because they're medications, they're drugs that are having that effect, but the old line of medications, is it correct to say that they affected more of the central nervous system and
Yes.
that stimulant
Yes.
effect to reduce appetite, whereas these are working more by mimicking gut hormones to send
Yeah.
messages to our brain. Tell
Yeah.
tell me about phentermine and your experience because this is one of those old line like
Oh yeah. Oh yeah. So I was in college and I was actually in pharmacy school. And I'm thinking like I was not really overweight. But I would love to be the size I was when I was in college. But phentermine, it was Atipex, was very common and very popular. And it was prescribed for me by a weight loss clinic because at that time it's like you really didn't. I'm not sure if they have that particular clinic around anymore. But I was able to just get an appointment and it was prescribed. And I had rapid weight loss, like rapid. And when I want to say, I think I lost like 20 pounds in like a couple of weeks.
wow.
Yeah, or probably about a month. But what I did notice was that, I did have the heart racing, this, it was a stimulant. And it also, because a lot of people do take it for, like memory or for, like to stay up, like to study, because they get like the similar
Yes.
effect to like the Adderall. And, I feel like that was like one of my best semesters in school because I was able to focus and like
Yeah, you were like
so
on
it's like I had the
speed.
best grade. Yes, exactly. And
And you
I
can
took it
see
for
why you ended up at that clinic because probably some other friend of yours in pharmacy school had lost some pounds and was like, "Oh my god, it's the best thing ever. I have so much focus. I've lost like 10 pounds." And like then you find yourself there.
yes.
And then
Yeah,
people are
I mean, I was
asking
like the
you,
smallest.
"Yes.
Yeah. And I was like the smallest I'd ever been. But then, I started having blood pressure issues, a lot of anxiety. So, I ended up in the emergency room with heart palpitations. And, I was like, this is dangerous. Like, this is a dangerous drug that people are just prescribing for anybody. And it's like, I have high blood pressure. I really should not be on this.
You had high blood pressure before you started
Yeah.
taking this."
Yeah. Yeah.
No.
Yes. I have a family history
And it was
of,
still given to you at this weight loss clinic.
yeah. Yeah.
Wow.
So that's very dangerous.
Wow.
And a lot of people don't realize that, there are health conditions that if you have, you shouldn't be prescribed these medications. Just like with the injectables, these and weight loss injections, if your family has a history of medullary cancer or thyroid cancer, then you should not be prescribed these medications. So that's where a healthcare professional comes in, because they are supposed to ask these questions and
But
they are supposed to assess. Yeah.
and that doesn't always happen because you shared with me, and I didn't realize this, that we talked a bit ago about, who's typically prescribing these. It could be primary care, but like you said, often it's your endocrinologist who may be. In your case, you had the conversation with your cardiologist. And so in those cases, you are working with a provider who knows your background. They're looking at your whole history. They can sort of help you, or help anyone like weigh the pros and cons, like, how much effort have you put into this before? Or what are other medications you're taking? What are other conditions you have that maybe you're at such high risk in these areas that taking one of these injectable weight loss medications, it is a potential benefit because it's going to, help if you're high risk or your weight is a high risk in these other spaces. But it's not just that. Like these are also at, we'll call them medi spas.
Hmm.
So you had tell me about that, because we won't say the name of it, but it's like a
Yeah.
medi spa that's like it's actually, I won't say any more. I was going to say about it, but
Yeah. Yeah. Yeah.
but
Yeah.
tell your experience with that, because I didn't realize
So
that this place is dosing
yeah,
this.
so there are, for people who don't have like a primary care physician or don't have access to a provider who will prescribe, because let's say you go to your doctor and your doctor says, I don't want to give this to you, I'm not prescribing this for you.
I'm not
You
comfortable.
can, right, you can say, okay, well, I'm going to go get it. And you can go to a med spa, pay a consultation fee, and it have it prescribed, and you can either purchase it to take home or come in to get weekly injections. So like I've seen advertisements where you can, do this process, come in to get the weekly injection, and that's essentially it. So I have the concerns that, it may be prescribed inappropriately. And what I mean by that is someone may have a condition that, is contraindicated. And, the prescriber may not know that.
If they don't have, they may not have access to their full medical records. And in this case, in the type of a kind of a standalone medi spa, they probably don't have
Yeah.
access. And so they're only going on what that patient is telling them.
It's said. Yeah.
And kind of going back to you in pharmacy school, like if you have high blood pressure and you, at that moment, you're in the mindset, you know, 2 decades ago that like, I don't care. Because then especially I think when people are younger, you don't think, you hear the warning, but you don't really think it matters. And so
Yeah.
in that mindset, it's quite possible you would have said, I'm just not going to tell them I have high blood pressure because I want to get
Right.
this or whatever it might be.
Right.
And in some cases like that, hopefully they would be checking your blood pressure themselves. But there's a lot of things that could be family history. There's a lot of other things that may not be revealed by the patient who's going to a kind of a place like a med spa, or may not be asked by that provider, or they just simply don't have access to the depths of that person's medical history. You know, the Fen was one that was like a real popular one, back a couple of decades ago. Phentermine, as you said, Adipex, that you took at kind of one of those walk-in weight loss clinics. I remember when I first started at the fitness center at Ochsner Fitness Center, I was in my early 20s, and for probably the first 8 or 10 years I was there, one of our regular members was a girl only a couple of years younger than me, and she was in a wheelchair, and she had very limited mobility. She had had a stroke from taking Dexatrom, over the counter Dexatrom. And so that was these that we're talking about. What was the ingredient in like old school Dexatrom?
Phenylpropylamine. Phenylpropylamine.
And that was one component of the fen.
Yeah. So it was phentermine and phenylpropylamine. Hmm.
And so that was what was in fen. One element of it, phentermine, was what she took, Alicia took, from the Adipex. The other being the, what was in this over the counter Dexatrom that this young girl, I mean, at the time she took it and had it, the stroke, she wanted to lose about 10 pounds, literally 10 pounds. She had been a dancer. She had a lot of pressure on, body size, distorted body image, just distorted self image, and took something like she got at a drugstore, seemed very safe, that it wasn't. And I wished, and I would, at the time I thought, gosh, I really wish she would share her story, and she didn't. She
Yeah.
was more private about it. We knew she worked with one of our trainers to try to maintain the mobility that she did have, or, kind of learn, self transfers, from a wheelchair to a seat and things like that. She was really almost like physical therapy type, or occupational type therapy exercises there. And it was just, to me, heartbreaking. And something like you with high blood pressure, yet still taking that. It was just it's like the luck of the draw, the roll of the dice, that wasn't you,
Right.
you know?
Absolutely. But I mean, there are prescribers that still prescribe that drug, and I've seen it prescribed in patients that have high blood pressure. Now, it's not contraindicated, so I mean that means that it can be prescribed. You just have to, monitor. But I mean, there are people that were I'm on it like long term, and you're
Yeah.
seeing the effects of it.
Right.
Um, so yeah, I mean, what I know now, I mean, I wouldn't take it,
No. No.
but I mean, in college, I
Yeah.
was like, okay, and I mean, I was just
Anything's possible, right?
right, yeah.
Do you feel that these newer weight loss drugs that we talked about, the Ozempic, the Wegovy, the Saxenda, the Mounjaro, do you feel that these that are kind of, acting on the gut hormones instead, or not even do you feel, on the side effects, or if you're weighing the pros and cons, do they seem safer than those old line
Um,
drugs?
I feel like they seem safer, but my hesitancy is in the cancer. I'm seeing like there are a lot of medications that, after people have been taking them for a while, a couple of years down the line, they come out with, increased, there's instances of cancer. So like this particular drug has the warning on it, and it says that it's a contraindication if you have a family history. So I just worry about, 10 years from now, people that have been taking the drug end up, having cancer. And then you think about, okay, I was just taking it for weight loss and now I have cancer.
Right,
But,
right.
versus, I was taking it to manage my diabetes and then, I have cancer. So I think that's a concern that I have and the hesitancy.
You're right, like, am I taking it for a few pounds, vanity pounds? Or is it something that I had a specific condition that I needed this in order to manage, and then this happened to be a side effect? Again, kind of
Yeah.
like the risk benefit. The Saxenda, as we look at the side effects of that one specifically, we talked about the other two. This was interesting because it says that let your physician know or your provider know if you have any other medical problems like alcohol abuse or gallstones. It can increase the risk for pancreatitis. It can affect, kidney function. And there's just, it goes on and on. And like you said, there's a long list of side effects that we know. But then, like you said, over time, 5 years, 10 years in, what
Right.
might that look like? And I think that's just like anything. It's, you know, if something is relatively new, and when did most of these come out? Like, how long have most of these that we're talking about been on the market?
I want to say like 20, maybe 2019 for some of them.
So less than 5 years ish.
Mhm.
And
Mhm.
in the conversation around drugs and medications, that's really new. When you think about how long something like Advil's been around,
Mhm.
and even with some of these that are really benign over the counter medications, things like, reflux medications, sometimes still they've been around for decades, and we still get studies that show, a reflux medication may be associated with XYZ long term, chronic issues. So, Alicia's concern of, we see this lengthy list of side effects, but then also what could be 10 years, 20 years down the road that might be discovered on these.
Right. Yeah.
So, the question I would say is, what would be your takeaway for people who are listening to this and they're wondering, is this something for me to consider? This newer generation of weight loss drugs. Okay, so that the fen and all this is behind us, the things that acted on our central nervous system, raised our heart rate, acted on our blood pressure and kind of had that stimulant effect. While those are still, like you said, prescribed, this is a whole new generation of weight loss medications and seeing people's success with these, seeing people's actual weight loss with these, that people would see that as successful and they would say, wait, I want to try that myself. What's your kind of message for them?
Well, I would my first uh response would be, to really assess what else they're doing, what else is in place to lose weight, because we both know that, you can use this medication and then once you stop taking it, if you don't have, a proper diet in place, or, a fitness routine, or, other things, you're going to gain the weight back. So it's like, okay, this is a quick fix, but how are you going to maintain it? Are you going to continue? So I would, encourage someone to have a plan, and just, in my situation, it's like, we talked about, I was prescribed the medication, didn't get it filled, didn't get it authorized by my insurance. I'm not really worried about it because, I'm not at the point where I feel like I need to take it.
Right.
I want to do other things first, and, even adjust my current medication to see, if I may be able to, affect slow down the weight gain or do something before I get to that. Because in my mind, I am weighing the benefits and the risks, because like, okay, if I don't, I still have to do all these things to maintain the weight. And I don't want to give myself a shot every week. I mean, and
Right.
it's
Right.
like, and it's just like, I feel like for me to have to do that, it's like
That's a
last
barrier.
resort. Yeah, but it's just like, this is the last resort.
You
Like, I
feel
want to
like
try other things.
there's still untapped possibilities that you want to put your
Yeah,
energy into.
yeah. And I think and this all goes into like the self care, self love aspect, is really trying to figure out um your reason for really wanting to get the medication? Like, is it like a vanity thing where, you feel like you need to lose weight? Is it self-esteem related? Or is it really affecting your lifestyle? As in, like, you having joint pain, or, difficulty sleeping, or sleep apnea. So like, I would really want to see like the effect that the weight is having on you before you go to the weight loss medication.
Almost looking at it, if it sounds like you're saying that if vanity is the only reason, it's probably not enough of a reason.
Yeah. Yeah.
And someone say, well, I am. Someone may say like I'm really vain. That's okay,
Right.
but and but that is when you are looking at, okay, what's the potential benefit versus the potential risk. I think we're both thinking that if it's just vanity, that's probably in our minds not enough of the benefit that you would be getting from it. But,
Yes.
just to kind of say what Alicia said in a different way, if you say my weight is preventing me from doing things in my life that I would otherwise want to do. I can't travel, or I can't do that activity, or go to this event with my kids or my grandkids, or I can't participate in certain things that I want to do because of my weight, or there's other things that is putting you at risk for other chronic conditions that is severe enough. At that point, you may say, okay, this is worth, bringing up and having this conversation with your
Mhm.
provider. And it would be really, really open, honest with your provider. And, in some cases, you may say, well, I've tried, nutritional changes, or I've tried exercise and it hasn't worked. Well, have we really tried it full force? The it hasn't worked. It's like there was that, like, I can't even remember what the commercial was for, but like, the guy goes into the gym, steps on the scale, and then he runs a lap around the gym, steps back on the scale, you know? And so it's
Yeah.
like, or, we may think something didn't work, but how much, or how much did we put that effort into it? Or how consistent did we stay with that? How long did we give it that try? But if we joined a gym and we just didn't go, or we tried making nutritional changes, but it was only for like a week or two, or, we tried an exercise plan, but it was only for, a couple of days and then we kind of got off track. Like, that isn't really the full effort. And so sometimes it may also be that, the answer that you and your provider may land on, maybe it's something that is out of the normal spectrum that you're thinking. Maybe it's working with a counselor on behavioral change.
Mm,
Maybe it's if there's, someone is struggling with anxiety, and something like food is sort of that numbing out tool.
yeah,
Even someone may say, well, maybe there's other things even besides medications for anxiety that can help address that. So there's so many factors in there that I would say, if weight is prohibiting you from doing what you want to do in your life, and or increasing your risk for other conditions, just having that real open conversation, like, and that conversation may first be with your provider, because maybe it's easier to talk with that objective person, or if it's someone in your life that you trust, that or maybe someone who's had that experience, if you have an Alicia in your life that you can talk to about that, because
yeah.
sometimes we can't see it in ourselves,
Hmm.
but maybe for someone else, talking through it with someone else, they can help us see like what some of those barriers are that maybe we're not even aware of it.
Yeah, yeah,
So I think thinking of these things and really, I guess, emphasizing from Alicia's point and my point is that even though these are what appear to be, potentially safer, and at least in the fact that they're not having that stimulant effect and those risk factors associated with it, nothing is without side effect, and nothing's a quick
right,
fix.
right.
Anything else that you would say, things that you're seeing on social that are like kind of those burning questions in people's minds, or anything that is something that we haven't covered on it?
No, I mean, I think the question was always like, okay, what are these drugs and like how do they work? And I'm always an advocate about making informed decisions. So I think that this was great to touch on how they work and the concerns and who the medication is for. And I think that that's helpful. And this should answer a lot of questions and help people make the right decision for themselves. You know, I don't want people to, I've seen comments where people are, upset that it's being used for weight loss and it was on back order
Yeah.
for, people diabetics. And, I go back to how obesity is a chronic disease. It is a disease, and it is prescribed for that. So I don't believe in shaming the people who really are taking the medication and really need to take it for obesity. Just because it is used for diabetes as well. So I just wanted to make that clear for people who feel like, well, they shouldn't be taking that anyway.
Right.
It's for diabetics.
And
Yeah.
so the four main ones that we've talked about, Saxenda and Wegovy. Saxenda is Saxenda, and Wegovy is Wegovy. Those are the two that are FDA approved for weight loss.
Yes, and the other one is approved as well. Wegovy and Saxenda. Yes,
And then the Ozempic, which is Ozempic, and Manjaro, which is Mounjaro. Told y'all these are like mouthfuls. Those two are specifically FDA approved to treat diabetes. And so that's kind of what Alicia's talking about, and we mentioned that Ozempic and Wegovy, the Ozempic for diabetes, the Wegovy for weight loss. The dosage is different, but medication's essentially the same. So when there's a shortage, that's sort of where the riff comes in that Alicia
hmm
was talking about. So, the takeaway is there's not a quick fix. It's a very open, honest conversation to have with your provider. I am a very big advocate with our clients to talk with your provider about medications, but also talk with your pharmacist. And I'm not just saying that because I've got Alicia looking at me on the FaceTime here. I always will recommend when someone is looking at how medications interact, either with other medications or with supplements that they're taking and anything in their lifestyle, talk with your pharmacist, because they can take a look at every single thing you're taking and look at how these things interact. Because providers who are prescribing these, they may not be as familiar with all those other medications you're taking and how they can interfere with one another.
Yeah, absolutely.
All right. Any other takeaways? Words of
Self
wisdom.
care. I say that self care is preventative medicine. So, by taking care of yourself, you could prevent high blood pressure, other health conditions. So that's my takeaway. Just really focus on self care.
It's something that you continue to learn and experiment yourself. Like I feel like you're sort
Yeah,
of that you're like your own um evolution and continuing to
yeah,
learn and evolve and share that with us.
yeah, yeah.
So check out Alicia's website, yourselfcareprescription.com, and follow her on social, Dr. Alicia Reed. And thank you, Alicia. I really appreciate your time always with us.
Thank you for having me.
A tremendous thank you to Alicia for carving out the time to walk us through this new generation of weight loss drugs. I think her perspective is really interesting, as a pharmacist, also as a person who has considered these herself, had conversations with her physician, and has that experience with the older line, the older generation of these. And so, really kind of can bring this full circle and really provides that unique perspective for us. I also want to encourage you. So, we're doing the entire episode on weight loss medications. And so, of course, there's so many lifestyle changes and lifestyle edits that we talked about. And one that I really would like to encourage specifically is to work with a registered dietitian. The registered dietitian can help guide you, be that resource for you, meet you where you are, not necessarily turning everything upside down. It doesn't have to be, this giant undoing of what your routine is, but instead, meeting you where you are, hearing where things are, hearing these challenges, and really helping to guide you in, behavior changes, micro steps, habit stacking that, things that can ultimately be very, small steps and not feel like a life changer, but ultimately can end up being very significant improvements, lifestyle improvements. Of course, we have our team of dietitians over at Ochsner Fitness Center. We've got 3 there with Ochsner Fitness Center. They are able to meet with you locally here in the New Orleans area, North Shore area, in South Louisiana. Also, they can meet with you virtually for anyone who is located throughout Louisiana or Mississippi. And insurance also is going to cover it, and you can meet with them virtually. If it's self-pay, they can do virtually for anywhere outside of even Louisiana or Mississippi. So the best contact, I'll also include this in the show notes, but it is nutrition@ochsner.org. That takes you straight to our scheduler. She's amazing. You can let her know that you have an interest in learning more about our nutrition services, and our scheduler's name is Lindsay. Lindsay can connect you with all of that information. So nutrition@ochsner.org, that's OCHSNER.org, brings you straight to our specific team of dietitians. But wherever you are, wherever you're living, whatever resources you have, working with a dietitian can be just a really beautiful accompaniment to the other lifestyle changes that we're making. And of course, I'll include the links that we talked about in the show notes of this episode. I am registered dietitian Molly Kimball, and you've been listening to Fueled Wellness and Nutrition, the podcast. If you like more Fueled Wellness and Nutrition, please head over to mollykimball.com, and you can follow me, Molly Kimball RD, on Instagram, Facebook, and Twitter. And if you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Join us next week for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest,